Welcome to 321 Kids Fun, a channel by parents, for parents and their children. In our previous video we answered some basic questions on what the coronavirus is, how to protect yourself, its causes, symptoms, and prevention. In today's video we will focus on what you as parents should know, and how you can better protect yourself and your children. Before we begin, please don't forget to like, share, comment and subscribe for more videos. At the time of recording, more than 100,000 cases have been recorded worldwide. Out of these, there have been nearly 4,000 deaths. At the same time, more than 62,000 people have recovered, according to Johns Hopkins University Center. Global markets also suffered their worst day since the 2008 crisis, while trading was briefly suspended in New York. Italy has extended its emergency coronavirus measures, which include travel restrictions and a ban on public gatherings, to the entire country. Experts believe most people who get the infection will only have a mild version of the disease. Some will be asymptomatic, meaning they carry the virus but experience no symptoms. Most people who develop symptoms do so by around day 5. Anyone who is symptom-free by day 12 is unlikely to get symptoms, but they may still be infectious carriers. The virus is transmitted through direct contact with respiratory droplets of an infected person generated through coughing and sneezing. It can also be spread by touching surfaces contaminated with the virus. The COVID-19 virus may survive on surfaces for several hours, but it's important to realize that simple disinfectants can kill it. The main symptoms can include fever, cough and shortness of breath. In more severe cases, infection can cause pneumonia or breathing difficulties. More rarely, the disease can be fatal. It appears that older people and those with pre-existing conditions may be more at risk. The symptoms are similar in nature to the flu or the common cold. This is why testing is required to confirm if someone has the coronavirus. There are 4 main precautions you and your family can take to avoid infection. 1. Wash your hands frequently using soap and water, or an alcohol-based hand rub. 2. Cover your mouth and nose with a flexed elbow or tissue, when coughing or sneezing. Make sure you throw away the tissue into a closed bin. 3. Avoid close contact with anyone who has cold or flu-like symptoms. 4. Seek medical care early if you or your child has a fever, cough or difficulty breathing. The use of a medical mask is advised only if you have respiratory symptoms such as coughing or sneezing to protect others. If you don't have any symptoms, then there is no need to wear a mask. Since this is a new virus, we do not know enough yet about how it affects children, or pregnant women. However, we do know that it is possible for people of any age to be infected with the virus. It's important to note that so far there have been relatively few cases of COVID-19 reported among children. If you think that your child has symptoms of coronavirus, then you should seek medical attention immediately. But remember that it's flu season, and symptoms of COVID-19 such as cough or fever can be similar to those of the flu, or the common cold. As with all respiratory infections, seek care early if you or your child are having symptoms, and try to avoid going to public places to prevent spread to others. If your child isn't displaying any symptoms such as a fever or a cough, and no public health advisory has been issued affecting your child's school, then it's best to keep your child in class. Make sure you teach your child good hand and respiratory hygiene practices for school and elsewhere, like frequent hand washing, covering a cough or a sneeze, and not touching their eyes, mouths or noses if they haven't properly washed their hands. Make sure your child is up to date with vaccinations. This way, your child is protected against other viruses and bacteria causing diseases. Anyone planning a trip overseas should always check the travel advisory for their destination country. In addition to taking standard travel precautions, and in order to avoid being quarantined or denied re-entry into your home country, you are also advised to check the latest COVID-19 update on the International Air Transport Association website, which includes a list of countries and restriction measures. At this time, there is not enough evidence to determine whether the virus is transmitted from a mother to her baby during pregnancy, or the potential impact this may have on the baby. This is currently being investigated. According to UNICEF, pregnant women should continue to follow appropriate precautions to protect themselves from exposure to the virus, and seek medical care early, if experiencing symptoms, such as fever, cough or difficulty breathing. All mothers in affected and at-risk areas who have symptoms of fever, cough or difficulty breathing, should seek medical care early, and follow instructions from a healthcare provider. Considering the benefits of breastfeeding and the insignificant role of breast milk in the transmission of other respiratory viruses, experts suggest that the mother can continue breastfeeding, while applying all the necessary precautions. Finally, there are a lot of myths and misinformation about coronavirus being shared online. This includes how COVID-19 spreads, how to stay safe, and what to do if you're worried about having contracted the virus. It's important to be careful where you look for information and advice. For example, the WHO has a useful section addressing some of the most frequently asked questions. It's also advisable to keep up to date on travel, education and other guidance provided by your national or local authorities for the latest recommendations and news. We have provided some links below. Please remember to subscribe for more videos.